What exactly is whooping cough? Perhaps you've heard its name, Pertussis, or maybe this is your first time encountering the term. Regardless, this video is here to shed light on this highly contagious respiratory tract infection that's been a part of human history for centuries. First things first, unraveling the mystery of what whooping cough, or pertussis, truly is. It's an infection caused by a bacterium known as Bordetella pertussis. This little intruder latches onto the tiny hair-like extensions in your respiratory tract and releases toxins, which in turn cause inflammation and swelling. This is the root of the problems that are about to unfold. Now on to how this disease makes itself known. The symptoms of whooping cough are quite deceptive, beginning much like the common cold. You might experience a runny nose, low-grade fever, occasional coughing, and a general feeling of being under the weather. However, after 1 to 2 weeks, these symptoms take a dramatic turn. The mild cough transforms into severe rapid coughing fits, followed by a high-pitched whoop sound as you gasp for air, hence the name whooping cough. So, what can one do when faced with whooping cough? Treatment typically involves antibiotics, which can control the symptoms and prevent the spread of this disease. It's crucial to start antibiotics early, ideally during the first week before the coughing fits. Hospitalization may be necessary for severe cases, particularly for infants under 1 year of age, as they face the highest risk of complications. While it's important to understand the treatment, prevention always beats cure. Vaccination is the most effective preventive measure against whooping cough. The DTaP vaccine shields infants and young children, while the TDAP vaccine serves as a booster for older children and adults. To encapsulate whooping cough, or pertussis, is a highly contagious bacterial infection that starts off resembling a mild cold, but soon escalates into intense coughing fits, followed by a distinctive whoop sound. Treatment usually involves antibiotics, and in severe cases, hospitalization might be necessary. However, prevention is always the best strategy, and that's where vaccination comes into play. Remember, knowledge is power. Understanding what whooping cough is, its causes, symptoms, and treatment can help in early detection, prompt treatment, and most importantly, prevention. So stay informed, stay healthy, and do your part in keeping those around you healthy too.